my patients have really accepted that I want to be their primary care provider of their oral cavity. I want to help them keep their natural teeth until they're 90, even when it costs a lot of money to do it. Learning that the styles of their team needs to be at a part of the conversation in order to get the outcomes you want is going to be key to getting the results that you want.
Welcome back to the Apex Perspective. I'm your host, David Lohmann, and with me as always is my partner and co-host, Matt Hale. Today, we're joined by our co-founder and my wife, Dr. Layla Lohmann, who many of you might remember from our very first episode. In this episode, we'll be diving into proactive patient care, what it really means, and how a doctor's mindset and confidence influence the way care is presented and experienced by the patient. Layla, it's great to have you back. Thanks for joining us.
Thanks for having me back, guys. I didn't know if you'd get me back after the first one.
Do we have a choice?
Nope.
We've run through our options. We're circling back. So it's good to have you join us.
Yeah. So Layla, you've been really driving force behind this move from the idea of reactive dentistry to proactive care, both kind of within our CE programs at Apex and more broadly beyond. Talk to us a little bit about what that means and why it's become something that you're so passionate about.
Thanks for asking, Matt. Over the last several years, I changed my mindset of being a conservative restorative doctor to being an active, proactive healthcare professional. And it's become a passion of mine because when we think about who are patients and who do we serve, everybody's a patient. My husband's my patient. You are my patient. And when I thought about how to help you long-term for the connection of overall health, I stopped thinking of myself just as fixing teeth when they became a problem and how to avoid those problems. And to your point, why are we not teaching people how to do this effectively, and what tools do they need to learn to become a proactive healthcare professional? It takes some time to relearn that because they don't teach that to you in dental school.
Layla, I think this is an interesting point. I just want to kind of better understand. So oftentimes you use the word conservative dentist, and we hear that a lot from doctors, especially early in their career, as you kind of acknowledged coming out of school. And I think the implied counter to conservative is aggressive, versus proactive, which I think is an interesting concept. So talk a little bit about how, conservative and proactive aren't necessarily different approaches in terms of how, in terms of treatment philosophy, but rather, a different approach to the same and best long-term solution for the patient.
Yeah, it's interesting that you noticed that because I have not technically changed my dental philosophy in the sense of how I treat a tooth. It's more of how I have conversations around the condition that the tooth and the mouth currently are. And when I was younger, I was worried about patients expecting me to sell dentistry. They thought that I was just fixing, something that didn't hurt them. And it aligned me to being conservative, wait and watch it get worse mentality. I mean, what am I waiting for is what I ask myself now. And if I'm waiting for the patient to feel comfortable in understanding their condition, I have to guide them to understand what that condition is and how actually it's a higher risk to not treat it now. And so, to your point, I used to think doctors might have been aggressive or was more, I guess aggressive is the right word.
Overtreating, I think,
Yeah.
is the implication by
Yes.
many. Yeah.
Yes. And when I thought about that, to be honest, I was in my own head about a roadblock of why are they crowning every crack? I mean, what do you know cracks do? They break. They go beyond the bone. Then they, end up being an implant. And so the difference is when I was younger, I thought that was the right approach. But really, proactive means that I still do the dentistry that is necessary. I just changed how I talk about their conditions, and I don't own them as a healthcare professional anymore. I then put that on them so that they have a choice to decide whether or not they're going to crown that cracked tooth, as long as they understand the risks and the benefits of doing the prescribed care. And that has been truly how I shift my conversations. And so when they tell me no, I just make sure that they understand the risk. And if they say yes, then great. Let me know when you're ready, and I'm here to fix it when it's a problem.
It's interesting. We've all seen these practices, or at least heard the stories of doctors. Oftentimes it shows up in nearly 100% treatment acceptance. And it's because pretty much the only thing that some doctors are diagnosing is broken teeth, problems, stuff that is, now actively causing pain. And I think philosophically, if I read between the lines for a lot of doctors that have operated this way, it's a couple of things. One, it puts them in a position to where they are every day solving a problem, and I think the human element in a healthcare provider that makes you feel good. Um,
Yes.
I think the other, you know, it's easier to not give bad news to patients at times than in. I say easier. Um, that philosophy or that approach is really allowing them to come to you and go, "Hey, I've got a problem." And you go, "Oh, now I can fix it," versus, "Hey, this is a problem or going to be a problem. Let's think about addressing it now." And so it's really interesting. Years ago, Dr. Fouché, who's, been on this podcast and uh, talked to me about kind of his mentor's approach when he came out of dental school. And he talked about this approach that oftentimes crowning a tooth is actually the most conservative thing you can do. It provides yes, it maybe isn't the simplest or the most basic approach that could fix the problem today, but it does have the longest term outcome for many of this. And so it was an interesting shift for me to better understand that mindset, that conservative versus aggressive or over treating, and where the two aren't entirely at conflict with one another. If you can kind of break it down and really understand where that doctor and in many cases that patient is coming from.
Yeah, I think that's an interesting point. Reframing how to keep their teeth stronger longer instead of fixing the filling 2 years later, getting a bigger filling because their home habits aren't changing. We're just watching things continually, progressively do the life cycle of dentistry where it goes healthy tooth, filling, crown, root canal, and implant. And if you're just taking care of teeth that are broken, it feels good because you fixed a problem, but you're not addressing holistically what's going on in their mouth and why it happened. And so that patient actually starts losing trust if every single time they only keep having problems. And my approach the last few years, my patients have really accepted that I want to be their primary care provider of their oral cavity. I want to help them keep their natural teeth until they're 90, even when it costs a lot of money to do it. I explain it's going to cost you that money over the lifetime of dentistry. And I just want you to have a pathway that doesn't feel like we're constantly fixing things. So it's been very good.
Where does this approach start in your practice? Is it entirely in the doctor's hands and with you and your partners? Is this a whole team approach where it starts in hygiene? Kind of how have you approached implementing this philosophy into your practice?
I mean, first I had to get my own philosophy and reframe it in my head that it's not a burden to have conversations about my patient's conditions. And it felt like there was less pressure, that didn't feel like Dr. Oz or Google or somebody was going to make me defend my position in dentistry. So that was like number one, was like my confidence personally in shifting. I'm a dentist, but I'm human. It's their condition. So that was one. So once I got that clear, I want to be a proactive healthcare professional. Then I started going down to what does that look like and how do I implement that in my practice with my team? How do I get my team to reframe, reset? What does that look like and how to deliver on our patient promise every single day? So then I leveraged technology and started learning how to use technology like dental health scans and AI to help my patients understand their conditions through color and visuals. And then when I did that, it took a lot of training to reframe my team to prioritize their time in their 1 hour period. And then, so before I did that, I found the technology and then I got my team to understand my why and then asked, do you have any questions about my new approach to overall comprehensive care? And there were a lot of questions. there was a lot of pushback. There was a lot of the conversation like, are we just trying to sell more dentistry? And just it was uncomfortable to have had this newfound, I want to be a proactive healthcare professional. I'm going to do this for my profession. And my team is like, no. So then to answer your question, over the last 18 months, actually going on 3 years now. So when I came back from Glidewell, um, they see it and my hygienist feels less burden on conversations about conditions. You can see it in her numbers, in her patient outcomes. Everyone has a healthier mouth because we started having those conversations, and my case acceptance went up, our production went up, and ultimately it's driving better outcomes for my patients, and my business is more healthier being proactive. So it started with me and stopped being a roadblock to care and holding my team and myself accountable to deliver on that every single day.
So, Layla, one of the things that you're also passionate about is this idea of inward versus outward mindset. I see a real parallel between what you're talking about and inward and outward mindset. Really, what you're describing is you did a lot of inward motivation and inward thinking, right? In the old way that you approach this versus turning it outward and being really focused on the patient.
Yeah. It's interesting to take it because every day I have to remind myself to not overthink. And I talk about this with David. I'm a recovering overthinker. And what that looks like is if I'm in my own head, I'm not present with my patient. And so how do I stay present? If I feel like I'm overthinking things, I start getting curious. So I try to catalog when I'm in my own head. It's probably because I'm triggered. Someone told me why. And I'm like, well, I just spent 7 minutes explaining to you why with all the technology. So it feels weird to be asked why again. But the patient, instead of thinking of them as an obstacle in the care that they need to be getting, I think of them as a person and I ask a couple questions. What do you need to understand your condition? What challenges do you see yourself building habits to keep my restorative dentistry healthy? And it's been a lot more freeing that when I think outside my own head, I'm present in the care, and it ultimately drives the patient to understanding it and accepting it. So it is a daily practice.
Uh, Layla, one of the things that, so kind of compounding on that, look, a change in approach and philosophy, I guess, ultimately leading to hopefully better outcomes for your patient, a better way of practice that where you're enjoying yourself more. I think a lot of doctors listening to this can go, "Hey, I want that," and they can make the personal decision whether they will personally commit to doing what they need to do. Whether that's understanding this inward versus outward mindset, changing their behaviors, changing their approach, going through the brain damage at times to re-explain to patients kind of why why there's been a change or why they are recommending what they're recommending. They control that piece. If we go back a few minutes, you talked about some of the pushbacks, roadblocks that you receive from your team. I think this is something that's going to resonate with a lot of doctors listening to this. Whether that's a clinical philosophy, a technology, any sort of change in the practice, oftentimes receive some, well, that's not the way we've done it. And so you maybe feel like you're pushing that change uphill. What advice do you have for doctors who might be concerned about that and that be a reason that they don't even, take on this endeavor, and maybe, share some of what worked with your team in terms of getting them over that mental hump?
It's a great question. Um, my first advice would be the responses you get from your team is typically how you communicate. It's what you're communicating, and that's a reflection of your communication is those responses. So originally the pushback is maybe I'm communicating a thing that somebody needs more time to process, and I've just blurted out, this is what we're doing, and they feel it's risky, they don't like it. So my first advice would be, that's the second thing. It was inward and outward mindset helped me, and then communication styles. My first thought and advice would be understand your communication style. Because typically, if you're communicating things poorly, even though you think it's clear, that's probably where resistance happens. So I like disc communication. That's what we brought into our organization. So once I learned my communication style, I realized that people weren't talking to me the way I wanted them to talk to me. And in reality, I needed to communicate slightly differently to be more effective. So I then got my team to get disc once I learned my style, and I learned how to talk to each person. So when I talk to them now, I address it in 5 minutes from 3 different styles. So if they're conscientious and need accurate data, I explain how technology will help me get to our patient's care 10 times quicker than the way we used to. If it's somebody who's direct, I say, we're going to get in and out faster. So it'll get our patients in and out faster and save you time and energy later. If I'm talking to an I or an S, I tell that S who wants, they're very loyal, they're very risk adverse. I say, this is going to be uncomfortable for 3 weeks till we find a better workflow. So let's talk this through. Let's plan in our morning huddles. Who needs it? Let's not do everyone at first. Let's do all new patients. So when doctors are trying to bring anything in their practice, learning that the styles of their team needs to be at a part of the conversation in order to get the outcomes you want is going to be key to getting the results that you want. So I don't know if that answered your question, but
No,
yeah.
absolutely. I think it leads into, if you take that same kind of line of questioning and apply it to how the patient receives this information. A lot of doctors uh, err on the side of being very conservative or reactive, because they don't feel the confidence maybe in themselves to go in and explain a problem, explain why we need to address it now versus wait, watch and wait. Talk a little bit about why your own communication style or communication confidence when it comes to the patient has been a really major driver in your ability to kind of make this change in your practice.
Yeah, it's been huge to help my patients understand their care. When you learn just the general nature of communication styles, and again, I'll use DISC as the example, I start realizing that I have to communicate their conditions in a way that they will hear it. So I usually communicated it with my passion and love of dentistry and getting them to say yes. And when they didn't, I felt like I was not the right dentist or I was not a good dentist because they didn't accept the care. And then it just went down a super destructive thought pattern for me. And so then I then reverted back to being conservative, wait and watch it get worse and fix the problem when it's a problem. And because that's what felt natural to me originally. But when I learned communication for patients, and you can pretty much tell a patient in like 3 questions, like what type of style they are. And there's 3 natural questions that you actually would be saying in your day to day, cadence with new patients or recall. And if I learn their style and explain their condition in a way that it's heard, they feel the value because I heard them. They then received the information to process it. And then they say, okay, what's the next plan? Instead, it'd be like, okay, well, let me see. So then when they say that, I said, what more information do you need to understand for whatever you need to make this decision that I can help you with today to do the care that I'm prescribing? And sometimes it's financial and we
I don't
that
want to
down.
go. Sorry,
Yeah.
I don't want to go fully down the DISC pathway, but for those that aren't familiar, you've mentioned a few times it's DISC assessment, DISC, and it's a tool to kind of better understand your personality and communication style. But it works with others too. It gives you insights into how others might receive communication best, and thus allows you to tailor your approach to that individual. Is that kind of conceptually correct?
It's behavioral.
Okay.
So not necessarily personality, it's your behavior and everybody has all the styles in them. Some come out natural, some are adaptives. And if you go home exhausted, it's typically because you're pulling out something that feels unnatural to you. And what the communication assessment allows you to do is to balance it out so you become more effective and less energy and effort in communicating the way people expect you to communicate or you expect it. So yeah, apologies for those of you who don't know DISC. It's a assessment that allows you to understand your style and then be a more effective communicator.
So we talked a little bit about technology and bringing technology in to help with the education that helps move the conversation from a reactive one to a proactive one. Tell me a little bit about the process, or tell us a little bit about the process that you went through to decide whether technology was something that was going to work for you in your practice long term versus something that maybe wasn't quite a fit, and how that has kind of played out over the last couple of years.
I mean, any new thing, I just get nervous about the time and energy and effort it takes to get my team on board. I think that's one of the biggest challenges that healthcare providers have. I do believe also that you're not confident that it's good, or maybe like it's going to take us longer because we've always done it the other way. And those are the most expensive words most people will say based on both financial and time and energy. And so for technology, I usually worked with the supported group, and you guys did a lot of the legwork of finding what was out there, doing the research, making sure that we were making the right decision to be forward thinking and being ahead of the curve so that we help our doctors and our teams be more effective in their day-to-day jobs. And so you guys are the ones who originally brought in the dental health scan, and I did not like it at first. I was so bad at it. Um,
But
I
now
would
you
say
feel stuck with it.
I can't imagine practicing dentistry without it. I actually think I did not substandard, but like I didn't do the best I could because you just detect things so much more effectively with the new technology out there. So once I started using it, I don't do physical impressions at all. And when I do, it's antiquated because now the gagging and all the patient experience is different. So that was the dental health scan one, and I can't imagine doing dentistry the traditional way anymore. Patients really, really like to trust and believe and see what's in their mouth versus blind trust. I think everybody wants that to see everything in color, and that's where AI came in. I would say it took me about probably 6 to 12 weeks to get less pressure because the team was frustrated that it wasn't working. And when technology happens and then your internet goes out, I mean, you don't want to be in my practice when that happens. It is just like, and I'm like, all right.
So you talked a little bit about it taking 6 to 12 weeks to start to get comfortable with technology and have it, um, begin to be helpful instead of an additional thing to do. How you have kind of balanced that and kept the engagement and gotten to that point where it starts to be helpful, and kind of the balance of that versus trying different tools and seeing what, in theory, what works, but actually never landing on anything.
I knew that it really helped my patients see their mouth from the view of the dentist. And I knew that using AI, they could understand the colors of their teeth and the layers of their teeth, which helped me reduce the idea of convincing them about their conditions when reality it's seeing it. So once I started really seeing the patients, the aha moment, the light bulb when, I'm explaining why their dentistry is failing, many patients would say, nothing hurts, or I keep having to redo this filling. And when I explain to them what is happening and why, and then showing them from the patient facing view of the dental health scan, they then can connect the dots themselves when understanding it's not the dentistry that's failing, it's the current position of your teeth. So once I started realizing patients value and trust, and they believed me in the first place, but now they actually accepted that their condition is current in their mouth and this is how we need to approach it to avoid problems later. It helped me stick to my guns um, to walk away when the things weren't up there. If the team wasn't putting it on there and they're like, oh, we'll get it right afterwards. And I'm like, I can't be the most effective dentist or professional without the tools to share with my patients. So let's go ahead and set me up for success so the patient ultimately gets the outcome they need, which is resolution of A, their problem, or B, a proactive approach to avoid future problems. And so when my team saw how valuable it was for patients to see it, believe it, and then move forward. They now have adopted, like, we don't bring Dr. Lohmann in unless the dental health scan is up and the Pearl AI is underneath it, because it helps with our workflow. And then we finish the patient, and ultimately it saves them time and energy later from having to redo things.
That's right. So let's pull that out. So you said we're going to use these tools. And then when you ran into those challenges of, oh, I'm running late, I don't have time, oh, I didn't do it, oh, I forgot, you didn't go into the room to do the exam until it was done,
Which
right?
cost them more time and running late. And when they realized I was serious, they gained time back because I walked away.
Right, right.
Yeah. Mhm.
And so how many times did it take that happening in order for that not to be a problem anymore?
A lot.
Yeah.
Uh, I mean, listen, when you're going back to back patients and you forgot one of those things and it's a new thing that I tried, it was quite a few. And then I waffled a couple times, which then they took advantage of that. And when I was like, oh man, that made it really hard to talk about dentistry, I didn't waffle anymore. So yeah, it was quite a bit. I mean, again, quite a bit is relative when you see 8 hygiene patients plus my column. So it feels like a lot in the day, but in the grand scheme of things, it probably is like 3 weeks, where they were consistent and committed to, she's not coming. And I'm walking and they're doing the handoff, they're doing the transfer of trust. And I'm like, is everything up? And they say no. And I just walk back. I don't even say anything. I just walk back.
And when you break it down into 3 weeks, I mean, that's not inconsistent, I think, with research out there that it talks of how long does it take to develop a habit, right? That's probably not inconsistent, but if you think about the impact it's had on the way you practice, your patients, your ultimate career, I mean, 3 weeks is nothing, to kind of make that commitment to yourself and to your team and to your patients to ultimately get the outcomes that you're looking for.
Yeah, and it's really been like proactive has been the game changer of how I deliver excellent care to everybody. You both are my patients. Like, that just makes me proud to help avoid those things. And I used to fear other people worried about selling the dentistry, and it reframing as a healthcare professional in the space of oral health has been a game changer. And my team adopts that too. So now my team will make sure that Dr. Lohmann is very proactive. Like, they'll tell the patients that for early on. So when we diagnose a condition, they know I'm thinking about this from a health perspective, not just fixing their teeth.
And I've heard you use the term before, patient promises. I obviously know what you mean by that, but explain that concept. I think importantly how that has not changed, and that connecting any change in the practice, whether that is the use of data, the use of technology, proactive patient care, and tying it directly to the patient promises, which I understand that your entire team understands, is on board, almost like your mission statement, your values as a practice. Talk a little bit about how connecting the two, first, what our patient promises, but connecting the two has kind of helped implement and grease the wheels of change, I guess.
Yeah, that's it's key. I didn't realize how much people have different values, just personally and professionally, and trying to get those people to use those values in their professional life was always a challenge, because people have their own beliefs and maybe they have fears. And when I tied it into, what do we promise our patients? So what is a patient promise? Is, how do I want my patients to get care over time? What do I promise every day when I show up to do for my patients? So that's my patient promise, which is basically, like you said, our mission statement. My patient promise is to be a proactive healthcare professional. Great. Now, how? I'm going to make sure to deliver outstanding care and measure that success. Great. How? And then I move down the process of, I'm going to make sure they understand their condition through dental health scans. I'm going to make sure they understand the teeth and the minerals of what's going on. And I do it very succinctly now using AI. And so my patient promise is, when patients understand the conditions that they have, when I prescribe care, they accept that care and profitability follows, at which point my team members can get those one team incentives and bonuses by just doing the right thing every time. And it also helps reduce the framework in my head when patients come and say resist or don't do what I say. I delivered on my patient promise with communicating things appropriately. You can decide not to do the care that I prescribe, and I get that. But it's my promise to remind you each time and be your accountability buddy and let me know when you're here because I'm here to fix it when we didn't do what I prescribed. And so my patient promise ultimately told my patients, I told my team members, is that a patient promise we can deliver on together? Because I can't deliver it on my own.
So you've talked a lot about proactive care and how it's changed both your experience of being a dentist and your practice, strengthened your practice, grown your patient base, grown your case acceptance, all the great things that you've had. For a dentist listening today who says, that's what I want, that's more what I want my practice to look like, that's where I want to head, what I want to become as a dentist, what advice would you have for them of how they could start that journey? What's one small thing they could do to kind of start down that path?
My advice would be learn your communication style first. Um, if you don't understand that, anything that you do beyond that is going to be a result that you may not like, and you may not meet those expectations. I guess if I would take one step further, maybe one step back, is confidence. If I could tell a dentist 2 years, 3 years out that forgive yourself what you don't know at that time, that only time and experience can give you. So, like, give yourself that grace that you may not be 15 years out and having these conversations, but now that you've heard this, you can change your approach 2 years out by just being confident in conversations about your patient's condition. So, like, confidence, one. And now, how do you communicate that so that patients accept the care you prescribe? Learning and mastering those skills to be a better communicator, both for your team and yourself. And then at that point, start connecting the dots. It's a relational position. Connect the disease state, connect relationships to being somebody who will help them get to where they need to go and guide them. And then go home and do the same thing personally. I mean, it just aligns both lives.
Yeah, I love that. Well, thanks for joining us, Layla. It's always great to have you on and excited to have you back in the future.
Thanks for having me, guys.